Hi, I'm Dr. Natasha Bhuyan. I'm a family physician at One Medical. We're an innovative primary care organization, and today I'm chatting all about urinary tract infections. Why are UTIs so common? UTIs are really common in cisgendered females because our urethra, so the hole that our urine comes out of, it's a little bit shorter. And so it becomes easy for bacteria that naturally exist on our bodies to climb up our little pee hole and cause an infection. In general, our urine should be sterile, so it should be bacteria-free, but bacteria can easily get in there. Why are UTIs more common in pregnancy? One of the big reasons is because our hormones change in pregnancy, and it actually makes it harder for our bladder to squeeze out urine. And so what ends up happening is that women are sitting with urine in their bladder, and that can become a breeding ground for bacteria, and so that can actually cause UTIs. Another thing that happens in pregnancy is the tube between the bladder and the kidneys actually dilates and gets bigger. And so it becomes a little bit easier for bacteria to crawl up into your kidneys and kind of cause that infection. And then one of the other things that happens in pregnancy is about 70% of women in pregnancy will get glucose, which is sugar, inside their urine. And when they get sugar in their urine, bacteria love to feast on that sugar, and so they're more prone to getting urinary tract infections. An important thing to remember about UTIs in pregnancy is you don't necessarily use the same antibiotics that you use when you're not pregnant because it might not be safe for the fetus. So certainly if you get a UTI in pregnancy, you should see your gynecologist or your primary care provider. Can UTIs spread? UTIs are not sexually transmitted infections, so they're not contagious. You cannot pass it to another person. That being said, UTIs are caused by E. coli and other bacteria that naturally exist on our bodies. And we do tell people, you know, you probably won't want to have sex when you have a urinary tract infection because the pelvic area is feeling a little bit inflamed, it's a little bit uncomfortable, so it makes sense to wait until after your UTI is cleared before you have sex. When do UTIs go away without antibiotics? This is a little bit of a myth. So I have a lot of patients who will tell me they felt the start of a UTI, they drank a lot of water and a lot of cranberry juice, and their UTI resolved. The reality is cranberry juice has this component that makes it harder for E. coli to attach onto our bladder walls. So yes, cranberry juice can help with UTIs, but when you have a full-blown UTI and lots of bacteria, that cranberry juice is just not going to cut it. So for most UTIs, you actually do need to take antibiotics to get them cleared. Certainly there are some instances, especially at the beginning of a UTI, when that bacteria is just starting to climb up your bladder, that's when you likely are able to clear it out and flush it out by drinking water. One thing I do caution patients about though, there are a lot of over-the-counter products for UTIs, and they claim to treat UTIs. But what they really do is they're kind of numbing up our urethral tract, and you think that you're feeling better. But the reality is now you're just numb and you're not feeling that burning sensation, but you might still have bacteria in your bladder. So the most important thing I can say is that if you feel symptoms of a UTI, if you feel burning with urination, if you're peeing a lot more than usual, if you have an urgency to go urinate, definitely see a healthcare professional. Should all UTIs be treated with antibiotics? Yes, if you have a urinary tract infection and you've gotten a urine culture and it's growing out bacteria, it's really hard to get that to resolve on its own. So you should see your primary care doctor and you should get antibiotics to treat that. What is the difference between a UTI and ureaplasma? So a UTI is usually bacteria like E. coli. It's something that generally exists in our system anyway. Ureaplasma is also a bacteria that a lot of people have in their system. But when E. coli gets into your urine, it will cause an infection. It is not supposed to be there. You're gonna feel symptoms. But meanwhile, with ureaplasma, you might have that in your urine and you may or may not feel symptoms. We do think it's good to differentiate and get tested. Most of the time when people have symptoms though, that is actually a bacterial UTI. When should a UTI go away? UTIs generally start to feel better within about a day or two of starting antibiotics, but the reality is you need to take the full dose of antibiotics to make sure that every single bacteria is killed. That generally would be about 3 to 7 days depending on the antibiotic that you have. If you start taking an antibiotic and you're still feeling UTI symptoms, you're still feeling burning, it's really painful, you can see your healthcare provider, and they can often give you medications that will numb the urethral tract as you're starting to recover. Will a UTI test show an STD? That's a tricky one. A UTI test is a urine culture. That's supposed to grow out bacteria, and it grows out bacteria like E. coli. An STI test is also a urine, but it's a different kind of urine that we run. We run a thing called a NAT, and basically what we're testing is we're testing the DNA of the bacteria. So if you're looking for something like chlamydia or gonorrhea, it's important to let your primary care provider know that you want to be tested for STIs, because that test that they're running for your urine might not necessarily find STIs. How do UTIs happen? There are a couple of different ways that UTIs happen. One really common way is E. coli or other bacteria gets into the urethra, which is where we urinate out of. There's a couple of different things that put us at risk of UTIs. One is sexual activity. When we're having sexual activity, we end up moving bacteria that naturally exists in our genitals, and it ends up moving into the urethra. Another risk factor for getting UTIs is if you're somebody whose anatomy just has your urethra a little bit closer to your rectum. Our general gut just has a lot of bacteria, and so bacteria can exist around our rectum. This is why I tell my patients, make sure you wipe front to back after you void, and don't wipe back to front. Another risk factor for UTIs is going through menopause. So when women go through menopause, their estrogen levels change, their vaginal flora changes, and they might be less adept at fighting UTIs. They might get UTIs more because urine is sitting in their bladder a little bit longer, it's not being squeezed out. And then the last risk factor is using spermicides. When we use spermicides, it kills sperm, but it can also kill good bacteria in our genital area that's often fighting bad bacteria. So we tell people who are prone to UTIs, don't use spermicides, just put that on the shelf, because there's other better ways to prevent pregnancy. Can UTIs kill you? Unfortunately, yes. If a UTI is untreated, it can be really dangerous. UTIs can keep moving through your organs, they can move into your kidneys, UTIs can end up in your bloodstream, and that bacteria is called urosepsis. When someone gets urosepsis, it's very dangerous to their lives, and I don't want to scare anyone, it is really uncommon to die from a UTI, so when you get a UTI, don't just blow it off, make sure that you get professional help and you get that treated. We see UTIs all the time in healthcare. It's nothing to be ashamed of. It's very easy to treat, and actually, you don't necessarily need to see a doctor in person to get it treated. A lot of primary care providers, like in our group, will treat people's UTIs virtually if they know they've got the symptoms, if they've had it before. So definitely reach out to someone that you trust, a trusted healthcare provider, and let's get that UTI taken care of.